Hi everyone, welcome back to my channel. For those new here, hi, my name is Jenny. I'm a third-year family medicine resident and a mom of two. So I feel like as a mom, I am always worried about how my kids are developing, if they're slowed or if they're falling behind. If you guys have followed me for a long time, you guys know that Wyatt had difficulties with his hearing and he had a chronic confusion, later requiring ear tubes. And so his language is a little bit behind others in his class. And so I feel like in order to relieve some of your anxiety or some of your worry about being a new parent is to give you information on what to expect at different ages and how your kids should develop. And also, even if you don't have kids, this is a great video for board studying. The boards love to test on childhood development. So I will review all of those in this video today. So if you guys are interested, then keep on watching. So I know that kids develop at a wide range of like fast or medium or slower paces. This is just like the average. So where does my kid fall on like this baseline? And it helps you guide your conversations with your primary care provider or your pediatrician, whoever your baby doctor is. So if you're worried, it helps you bring up these conversations. So that being said, there are 4 main categories of development. That is gross motor, fine motor, cognitive and social, and then language. And I will go through all of those today from the ages of 0 to 12 months old. So at 1 month old, gross motor skills, your baby is not doing much yet, but when you lay them on their tummies, they're able to lift their chin up momentarily. And then at 2 months, they should be able to lift up their chest. By 3 months, it's onto their elbows. And by 4 months, babies should be able to sit as long as you hold their trunk. So by 4 months, babies are also starting to roll. At 4 months, you should be able to see babies roll from front to back. And then by 5 months, it's from back to front. And then by 6 months, they start getting even more mobile and they start pivoting around. London does this like little circle or pivots backwards. Not crawling as of yet, but definitely starting to practice and moving. By 7 months, babies should be able to sit unsupported, so very steady on their own. By 8 months, this is when we really need to start baby-proofing the house because babies are mobile. They'll start army crawling at this time. By 9 months, babies should start being able to crawl with their arms like straight, like on all fours instead of the army crawl. And also by 9 months, babies should be able to pull to stand. By 10 months, they are cruising, so holding on to different furniture and getting around that way. By 11 months, they can walk if you hold just one hand. And then by 12 months, babies are generally walking independently. So walking on their own, walking or running on their own. I know Wyatt started walking about, let's see, like a few days after his first birthday. Next, we'll talk about fine motor skills, and that's usually with like, their hands. At 1 month, babies just should have their hands like close to their face, but still in a fist most of the time. By 2 months, babies can have their hands open about 50% of the time. And then by 3 months, they're really inspecting their fingers. By 4 months, they have their hands open the majority of the time and really grabbing at things. I remember both Wyatt and London always like to try to grab for my necklace when they were breastfeeding. By 5 months, they have that palmar grasp. So as I talked about in my previous video of baby-led weaning, you want to have food that extend to the sides of their palmar grasp because anything within this fist, they really can't get to because they can't open their fingers. They have to open their whole hand together. So they're only eating what comes out of the sides. So they can grab from hand, transfer to the mouth, and then transfer back to the hand. By 6 months, they should be able to transfer from hand to hand. So by 7 months, babies should be able to use like the more of the radial side of their fingers to grab objects. By 8 months, they can do like these scissor grabs, and then by 9 months they can use pincer grabs. By 10 months they can isolate their index finger and start poking you. By 11 months they can start throwing objects, like throwing food once you put it on their plate. And then by 12 months they can hold a crayon and start scribbling things, and they can start building a block tower of 2 blocks. So next we will talk about cognitive and social. During the first month of life, baby really are attracted to black and white things, and they also cry a lot out of distress. Month number 2, babies start smiling, and this is when you smile at them and they smile back at you, so like that social smile. So at 3 months, at 3 months, babies start having lots of different facial expressions of disgust or like sour. At 4 months, babies start smiling spontaneously to tell you, like, I'm happy, I'm just gonna smile. And then at 5 months, babies start really recognizing with their eyes visually their caregiver. So prior to this, babies only recognize their caregivers by their voice, and then now they're able to see much better and recognize visually. By 6 months, since they have better visual acuity, they have more stranger anxiety. So if it's someone new and someone they don't recognize, there's a little bit more anxiety there. By 7 months, you can see babies inspecting more aspects of a toy, and by 8 months, that's when they start developing object permanence. So if something falls on the ground, babies will look around to find where it is. So around 9 months, this is when kids develop separation anxiety. So anything before that, it's so easy for me to, in my clinic, examine kids and just take them from mom and examine them, do my physical exam and do my thing. But right at 9 months, when I take the baby from mom or caregiver, baby starts crying and screeching and like they want to go back to their parents. By 10 months, this is when babies start experiencing fear or can experience fear, and also they respond or understand their name. By 11 months, babies can be looking at pictures in picture books. I always recommend that families read to their kids. We have a special program called Reach Out and Read. So at every well child visit, we give kids a book that they can take home to encourage reading with their children. This is how you develop language. And then at 12 months, this is when kiddos point at objects that they want, like, ooh, candy, ooh, airplane, like things like that. So pointing is a very important developmental skill as well. And the last category is language. And so this one comes really close to my heart just because I saw how Wyatt was slow to progress in this category, so I wanted to make others aware. So in the first month of life, babies are mainly just crying. At month 2, you can start to hear cooing noises and vowel sounds. By 3 months, this is when babies chuckle and really vocalize when you speak to them. And then by 4 months, this is when they start laughing out loud and really talking to themselves, talking alone. By 5 months, babies are squealing and they're able to respond to their name. They also start expressing in other ways of why they're angry or upset besides crying. By 6 months, babies are mimicking consonants, so like da-da. Before that, they were just saying vowel sounds. So by 2 months, vowel sounds. So by 6 months, consonants. By 7 months, you should start really seeing a variety of sounds from your children. Things that are mixtures of consonants and vowels and, up and down noises. By 8 and 9 months, they're saying mama and dada, but these are very non-specific. So they can look at their sister or a stranger and say mama, mama, or da, 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 da. By 10 months, this is when babies are able to specifically say dada and mean their dad, or mama and mean their mom. And this is also when babies start liking to play peekaboo. By 11 months, they can possibly say their first word. And then by 12 months, this is when they continue to point at things that they want. All right, those are all the developmental milestones. Remember that this is just an average and a baseline of where you should go off of. There are obviously some kids who develop a lot faster, some a little slower, but these are talking points where you can ask your doctor when you go to well childs, or even if it's not a well child and you're concerned, definitely talking points to bring up with your doctor or your baby's doctor. So I hope you like this video. I hope you guys learned something. As always, thank you guys all for watching. If you haven't already, please subscribe, and I'll see you guys next week. Peace. Wyatt. Mama. Mama. That's not Mama. Mama. Hello. Mama. Mama. Mama.